Yeah, so I mean, in that case, if people aren't experiencing any symptoms but they do have diabetes, that's why it's important that someone with diabetes should be getting their eyes checked every 2 years, and that's covered by Medicare as well. So that's going to be at no cost. So if someone goes to see their GP, they can also go to their optometrist and be covered. So even if you're not experiencing symptoms, still go get checked out, because it's not going to cost you anything, and it's better to be on top of these things and catch it before anything happens. Well, an optometrist, yeah, when they look at the back of the eye, they can start to see those, the damage that's happening very, very early. So it's, you may not be able to notice it yourself, but if you see an optometrist, they can pick up those signs very early, and they can, refer you back to your GP, or if they need, further investigation, you might need to see an ophthalmologist, if the optometrist isn't able to find the cause of what's happening. So your optometrist, I mean, for most people, an optometrist, that's going to be your first port of call. They'll cover most of your basic eye needs. They're the ones that are going to do your comprehensive eye exam for people with diabetes. So they're the ones you're probably going to you find in your community, you're going to go to most frequently. Yeah, the reason an ophthalmologist is a specialist, so they have more training than an optometrist. And as I mentioned before, they might be referred to if some further investigation needs to be done, or if surgery, something like laser surgery, needs to be done. That's what an ophthalmologist will do. Yeah, I mean, the best thing to do is to follow your basic healthy nutrition principles. So that's, eating fresh fruits and veggies, trying to at least aim for a couple of pieces of fruit during the day, aim for 5 serves of veggies as well. Those are the kinds of things that are really going to help stabilize blood glucose levels, so that's going to prevent those long-term complications. And on the other side as well, minimizing those foods we know aren't particularly good for us, those kind of processed foods. They're going to raise our blood glucose levels. They're going to, increase the risk of higher cholesterol and high blood pressure. So trying to minimize, those foods we know we shouldn't be eating, and just concentrate on the basics, just getting the fresh fruit and veggies in there, whichever ones you like, just as much color as you can. That's the best place to start with trying to maximize your eye health. Yeah. Absolutely, the basics are, they're underrated. It's unfortunately a lot of people miss out on it. They're looking for the latest thing to fix what's going on, and going back to the basics is your first port of call, and then from there you can always tweak as necessary. But getting the basics right, most people unfortunately just aren't getting the basics right. So if they can do that first, then you're much more of a chance to reduce the risk of the eye problems that may occur. Yeah, I mean, there is truth to that. So there is absolutely. So there's actually a chemical in there called beta carotene, which is actually helps with eye health. So I mean, you're probably not going to cure your eye problems by eating carrots, but there is an element of truth to that. There is actually beta carotene in them, which actually helps with our eye health, keeps them nice and healthy. So. But that that is to do with all orange kind of veggies as well. So things like pumpkin or sweet potato, those kind of orange and red veggies, they all contain what's in those carrots as well, that beta carotene. So we don't just have to munch on the carrots. If you don't like those, there's plenty of other options for you. The health benefits of exercise, there's just so many of them, but when we're talking about eye problems, the best thing that exercise is going to do is going to help reduce our blood pressure, it's going to help reduce our cholesterol, and it's also going to reduce the blood glucose levels. And they're the three main risk factors that, if they're not looked after, that's when someone's more likely to develop those eye problems. So the big 3 things that impact our eye health can actually be improved by exercise. So the more people can exercise, the more they can reduce their risk of developing those long-term complications. So again, it's just trying to go back to the basics, find something that you enjoy. If it's just going for a walk, that's absolutely fine. Some people enjoy running or swimming or, going to the gym. It's finding out whatever you like and then just trying to keep up with it. That's going to help, a lot. Yeah, I mean, ideally we'd look for 30 minutes, but if someone's not doing anything at all, 10 minutes is a step in the right direction, and then you can start to build on it from there. But yeah, the research is showing 30 minutes a day on most days of the week, is really going to improve our long-term health. So, you know, that could be Oh, absolutely. It can reduce stress. It can reduce those stress hormones in the body. It makes us feel better. So, you know, there's just so many benefits of exercise that, you know, there's just so many that we could talk about today. But yeah, the blood pressure and the cholesterol and those blood glucose levels are really important markers of developing eye problems. So yeah, if you can just find 10 minutes of exercise at a time, you know, and work up over time. You don't have to get to it straight away. You've got time. So yeah, that's probably a key. Absolutely, and fit it in where you can. You know, is it on your lunch break? Might be in the morning or an evening. It's whatever suits you. So just trying to find the time and put it in your day, and that's going to help you most definitely into the future. Well, you know, that's a difficult one to answer because it is, the longer someone has diabetes, the more risk they are at developing those problems. So really it comes down to, I guess, when they actually got diabetes. So if you had someone that's developed it at 40 years old, you know, it may not have been diagnosed for 15 years. So if that's the case, you know, they may develop these complications sooner than they would think. But if someone is, you know, getting these regular checks and going to see their GP and it's picked up very early, then, you know, they're in a really good position to reduce their risk of developing eye problems. So it's really going to come down to how long has that person had diabetes for. And if it's been 15 years, then their risk is going to go up. But if they've just been newly diagnosed, then they've got, you know, a really good chance to reduce their risk of developing any of the complications, because it's not, you know, they don't have to happen. It's not a guarantee. So people can really do a lot of things to improve their chances.